respected chairperson of the conference, the organizers, as well as the respected speakers and guests. Greetings from Abu Dhabi. The topic of my lecture is role of herbal medicine in women's health, and with a special reference to some breast cancer. Well, plants have always been a common source of medicament, either in the form of traditional preparations or pure active principles. Well, in a survey done by World Health Organization, it has been estimated that 80% of more than 7,000 million, that is 7 billion inhabitants of the world, rely mainly on traditional medicine for their primary healthcare needs. And it can safely be presumed that a major part of traditional therapy involves the use of plant extracts or their active principles. So we can see that in a country like Ghana, they have the number of herbal medicine discovered or prepared for the cardiac, it is 7. For diabetes, it's almost 6. Similarly, for other diseases. Well, in developed countries too, actually, the plant-derived drugs are considered important. For example, in United States of America, 25% of all the prescriptions dispensed from community pharmacies contain plant extracts or their active principles derived from higher plants. The World Health Organization has noted that more than 125 plant-derived drugs are being used in medicine. Well, the major pharmaceutical companies are performing research on the plant parts for their potential medicinal values. The global medicinal plant sector, if you see that it was expecting that it will be $125 billion in 2022, and it reached to the value. Now let us see the classification of reported drug. Basically, I'm talking about the pharmaceutical drug, and you can see here the green in color. The genuine drugs are very scarce in number, very little, as compared to the falsified drug, which are falsified drug, as compared to the falsified drug, which are please. Well, something is good. Falsified drug. So I'm sorry. So let us come to the main role that the basically, as we know that cancer is characterized as the abnormal division of cells in our bodies, which leads to death. Almost 3,500 million people die each year from cancer around the world. And also you must be knowing that the cancer cells kill healthy cells in the body. Unevenness in the body can cause cancer and can be cured by reducing the disparity. Hundreds of dollars have been invested in the research, research to determine what cancer is. So basically we are talking about breast cancer, and breast cancer is recognized as adenocarcinoma, the most common cancer in the women and the second leading cause of death in women after lung cancer. And there is a pressing need to develop novel and effective anti-cancer agents. The critical factors that contribute to the breast cancer, it includes, as you know, sex, nutrition, alcohol consumption, body activity, family history, lifestyle, and the last one as endocrine elements, both exogenous and endogenous, are all linked to the breast tumors. Well, the other critical factors that contribute to breast cancer, it includes past benign conditions and mammographic density. However, it is still unclear which factor plays the most important role in the pathogenesis of breast cancer. As a result, the breast cancer has been the second leading cause of the death in women. Natural plant products have shown promising results As anti-tumor and anti-cancer agents, plants and herbs have played a critical role in human health maintenance. Herbal treatments are more commonly today than prescription drugs because they contain natural active compounds that can benefit human health. So let us see what are the common types of breast cancers. It includes invasive ductal carcinoma, liver breast cancer, ductal carcinoma in situ, less common breast cancer types, which include triple negative breast cancer, inflammatory breast cancer, Paget's breast cancer, as well as the subtypes are ER positive, that is the breast cancers that have estrogen reception. PR positive, breast cancer have progesterone receptor. HR positive, HR plus, breast cancer that have estrogen and progesterone receptors. HR negative, that is the breast cancers do not have estrogen. Breast cancer that don't make noise, please. I have estrogen and progesterone receptor, HER2 positive breast cancers, which have higher than normal levels of HER2, helps cancer cells to grow. About 15% to 20% of all breast cancers are HER2 positive. And hence, basically, if we see that what are breast cancer symptoms, as the conditions can affect your breast cancer in different ways. Some breast cancer symptoms are very distinctive, others that may seem like areas of breast that look very different from any other area. Breast cancer can cause noticeable symptoms either, but when it does, symptoms may include. And what are those symptoms? A change in the size, shape, or contour of your breast, a mass of lump, which may feel as a small as a pea, a very small, a lump or thickening in or near breast or in underarm, and then a change in the look or feel your skin on breast or nipple. These are the particular places, dimpled, puckered, scaly, or inflamed. It may look red, purple, or darker. A marble-like hardened area under skin. A blood-stained or skin fluid or clear fluid discharge from nipple. So basically, if you see you must be more aware than me that the condition, what are the breast condition symptoms? The condition can affect your breast in different ways. Some breast cancer symptoms are very distinctive. Other may simply seem like areas of breast that look very different from any other area. The breast cancer may not cause noticeable symptoms either, but when it does, symptoms may include a change in the size, shape, or contour of breast, a mass or lump, a lump of thickening, a change in the look or feel of skin, and there may be some other causes like marble-like hardened area under skin, blood stained or clear fluid discharged from skin, from nipple. So let us see that what are the complications of breast cancers. Basically, before that, let us see that what causes breast cancer. The experts knows breast cancer happens when breast cells mutate and become cancerous cells that divide and multiply to create tumors. They are not sure what triggers what that change. However, the research shows there are several risk factors that may increase changes of developing breast cancer, and these includes, for example, age, above 55 or older, sex, women and people are much more likely to develop the conditions than men and people AMB, family history, if parents, siblings, children, or other close relatives have breast cancer, of course, the risk is more expected. Genetics, up to 15% of the people with breast cancer develop the disease because they have inherited genetic mutation. The most common genetic mutations involve the BRCA1 and BRCA2 genes. Smoking, this also, tobacco use have been linked to many different types of cancers, including breast cancer. Drinking beverages containing alcohol. The researchers shows that basically the drinking of beverages containing alcohol may increase the breast cancer risk. Having obesity, radiation exposure. For example, if you have prior radiation therapy, especially to your head, neck, or chest, you are more likely to develop breast cancer. Then also the hormone replacement therapy. People who use hormone replacement therapy, which is called HRT, have a high risk of being diagnosed with the condition. So the complication of breast cancer, as you have seen, the most significant complication is metastatic breast cancer, then diagnosis and test. How is breast cancer diagnosed? Healthcare providers may do physical examination or order mammograms to check cancer, but they do the following tests to diagnose the disease: breast ultrasound, breast mutagenic resonance, breast biopsy, immunohistochemistry test to check the hormone receptor, and genetic test. Then stages of the breast: 0 stage, 1 stage, 2nd stage, 3rd stage, and 4th stage. Now, management and treatment. So surgery is the primary breast cancer treatment, but healthcare providers may use. This is very important that one should know that what are the breast cancer, how it is treated. Surgery is the primary breast cancer treatment, but healthcare providers may use other treatments. Breast cancer surgeries includes mastectomy, lumpectomy, and breast reconstruction. Besides, now chemotherapy, radiation therapy, immunotherapy, hormone therapy, and targeted therapy are the important parameters. These are that should be known to all. What are the treatment side effects? Now, the common chemotherapy and radiation therapy side effects, which include the fatigue, nausea, and vomiting. Well, let me say that the people react differently to the breast cancer treatment. If you are receiving the treatment, ask your healthcare providers how treatment may affect you, including how it may affect your daily life. This is very important. Also ask your providers about palliative care. Palliative care helps manage breast cancer symptoms and treatment side effects, so you are as comfortable as possible. You go through the treatment. You know that the many very famous common drugs are tamoxifen and raloxifene, are the only drugs approved by the United States to help lower the risk of the breast cancer. Actually, in the next slide, we can see that complications of the breast cancer surgery. After that, I will come to the herbal treatment. Yes, basically, all surgeries have potential complications, and the breast cancer surgery is no exception. So, as you are considering your options, it's important to remember that surgery removes potentially life-threatening cancers. In general, the risk of breast cancer overweight the complications. If you are having breast cancer surgery, ask your healthcare provider to explain potential complications. And that includes infection at the surgical site, blood clots, nerve, lymphedema, prevention. Can breast cancer be prevented? We may not be able to prevent breast cancer, but one can reduce the risk of developing it. Just as important, regular self-exams and mammograms can be help detect breast cancer early on when it's easier to treat. I think quite theoretical part have been done, and let me move to the part. May I know how much time I have, Madam Elena? Okay, let me have a brief about it. That between 1981 to 2014, almost 136 anti-cancer drugs were approved. And these were the herbal compounds are derivatives according to nearly with herbal compounds are derivatives which account for nearly 83% of them. Let us name the compounds: vincristine, vinblastine, vindacine. These are all from one plant, Vinca rosea. It is also called as Catharanthus roseus. And docetaxels are among the anti-cancer medications currently being used to cure breast cancer. Despite herbal product effectiveness in treating breast cancer and its complications, few herbal products make it to preclinical or clinical trials. As a result, further work would be required to effectively move these agents to an appropriate therapeutic environment in order to determine the herbal therapy ability. Now, the traditional herbs used to prevention of breast cancer or breast cancer is a condition that should be avoided. Estrogen play an important function in the proliferation of both normal and neoplastic breast epithelial cells. So let me say that estrogenic receptors, they're positive. Breast cancer accounts for almost 40% to 70% of all the breast cancer. As a result, one of the important ways for the detection of chemoprevention of breast cancer is to block the estrogen receptor. Second is the phytoestrogens or estrogen-like compounds found in the plant were first proposed as cancer prevention agents. In epidemiological analysis, found a low incidence of breast cancer in the soya consumption. Hello, are you listening, please? My voice is going well?
Yes,
Hello?
doctor. Yes, doctor.
Okay. Now, flavonones, lignans, cumulostine, and stilbenes are the structural group of phytoestrogen. Isoflavone are abundant in soybeans and soya products. Legumes and lignans, which can be present in the beans, nuts, whole grains, berries, and vegetables. They are two types of phytoestrogen groups. Actually, if we see the incident of breast in the United States, it has historically been 4 to 7 times higher than in the Asian population, where dietary isoflavone intake is comparatively as high as 20 milligram per day to 80 milligram per day. Furthermore, the epidemiological findings showed an insignificant 30% decrease in the breast cancer risk for women who consumed a higher percentage of dietary lignin. As a result, eating phytoestrogen-rich diet is one of the many possible breast cancer prevention lifestyles. Recent data suggests that phytoestrogen production prevently you can say it prevents the function of essential steroidogenic enzymes involved in the production of estradiol and circulating androgens and estrogen sulfates. As a result, this practice can play a key role in the breast cancer prevention. The phytoestrogen have also been confirmed to stimulate the G protein coupled receptor which has been identified as a novel estrogen receptor and plays a key role in estrogen-dependent disease, including breast cancer. Well, let me say that the function of phytoestrogens, on the other hand, is unknown and is dependent on several factors, including their composition, metabolism, and relative abundance compared to the endogenous estrogen. Phenolic acid, flavonoids, tannins, quinones, I'm talking all about plant secondary metabolites. This is from plants, herbal. Anthocyanin and other naturally occurring phenolic compounds, they play an important role in the cancer prevention and treatment. These phenolic compounds are found in medicinal herbs and dietary plants in abundance. By virtue of their wide variety of biological activities, some phenolic compounds contribute to the inhibition of carcinogenic mechanism and exhibits comprehensive properties. Now, let us talk about a few natural products used in the treatment and are listed below. Garlic. In garlic, allicin, which is responsible for odor and medicinal properties, is an originator of sulfur-containing compounds. Ajoine, a sulfur-binding compound used in garlic oil, is another sulfur-binding substance which selenium acts as an antioxidant. Ajoine slows the progression of cancer. Garlic also contains biflavonoids. These biflavonoids means if two flavonoids bind together, then this is the biflavonoids. By mistake, it's printed bioflavonoids. It's biflavonoids, such as cyanidin and quercetin, which have excuse me. I'm sorry. Which has actually, for last many days, I am traveling. I'm coming from China last night, and now today I'm joining your conference. Before that, there were two meetings. So I was talking that garlic also contains biflavonoids such as cyanidin and quercetin, which have antioxidant effects. This is garlic. You know better than me. Garlic's anti-cancer properties are due to the high content of organic sulfides and polysulfides. The mechanism behind anti-tumor activity, promoting lymphocytes and macrophages, is that they destroy cancerous cells and disrupt the metabolism of tumor cells. Echinacea is a member of Asteraceae family. It is uninhibited aromatic plant that grows mostly in North America and Great Plain and eastern areas as well as in Europe. Echinacea purpurea, Echinacea. There are many species. Echinacea is a genus and the second name is a species. So Echinacea purpurea, Echinacea angustifolia, Echinacea pallida. They are the three most widespread plants used in the herbal remedies. Not only for cancer, it's for many diseases. However, Echinacea purpurea is the most widely used species for study and care. Purple cane flower, Kansas snake root, black Samson, or several common names associated with the echinacea. Researchers discovered that echinacea purpurea increases the number of natural killer cells in the mice under study. In future, echinacea purpurea may be used as the...
There is one paper here, draft paper. You didn't see?
No, please, the conference is going on. I'm sorry. In the future, this echinacea purpurea may be used as anti-cancer treatment. And you know that the echinacea is a genus which contains flavonoids which serve as immune stimulant. Flavonoids stimulate lymphocyte activity and which enhances macrophage, phagocytes, and action of natural killer cells, prompting interferon assembly, and it has also lessened the harmful effects. The harmful effects of the radiotherapy and chemotherapy, according to Winston and et al., the reference I've given in the last. So flavonoids promote lymphocyte. Basically, it improves the phagocytosis of macrophage and the action of natural killer cells, prompting interferon assembly, and it has also lessened the harmful effect of radiotherapy and chemotherapy It also aids people in extending lifetimes as their disease progresses. Commercial preparations of echinacea juice has been shown to increase macrophage cytokine production. It has been reported in 2008 by two scientists. That's given in the. Then next plant is our burdock. Burdock is very, you know that its scientific name or botanical name is Artium lappa, and it's normally called as burdock. Its root can be found in Europe and Asia and is used there. Burdock is used in a variety of herbal medicines for a variety of ailments. It has gummy feel and soft flavor. Burdock was once used to treat arthritis, tonsillitis, and measles, but it has now been discovered that it has anti-tumor properties. So I will not go for the details of its active ingredients, but with the name, because it may be there are many plants, so much detail is probably not required. Turmeric. You know that turmeric curcuma langa is a significant word of turmeric. Turmeric gives food a dark yellow flavor. Turmeric's active ingredient curcumin is found in the rhizome and rootstock. Curcumin's phenolic compounds are believed to have anti-cancer properties. Curcumin has been shown to have inhibitory effect on cancer development at all stages, including initiation, promotion, and proliferation. It also increases the amount of glutathione and other non-protein sulfhydrates in the body, and the sulfhydrates work directly on various enzymes. Turmeric inhibits the synthesis of nitrosamine, resulting in an improvement of the body's natural antioxidant activity. Turmeric inhibits the speed of inhibit the spread of lung, breast, scalp, and stomach cancers. Curcumin is an antioxidant. You know that the affects the synthesis of synthesis of eicosanoids, including prostaglandin E2. In humans, it also has anti-inflammatory properties. So flaxseed is our next plant. The brown and golden hard-coated seeds are produced by the flax plant. All of the active ingredients are present in this. Omega-3 fatty acid, lignin, both of which are beneficial for health. The metabolism of lignans to enterodiol and enterolactone, which occurs in the digestive tract, it results in the estrogenic development of flaxseed. The next one is this is all about the flaxseed, and it is found in the literature, but the scientists prove that reduced as a result of this experiment. The malignancies were reduced to flaxseed and isolaricirinoyl diglycosides, the chemical compound. Well, there are many researches, and as a result, the flaxseed in the female offspring will improve mouse mammary tissue differentiation. It prevents malignancies, reduce tumor growth, rendering them less vulnerable to carcinogens. Now, green tea. I think this is the normal thing which we daily use. At the 5 minutes before, I have used it. So basically, Camellia sinensis. Camellia sinensis is the scientific name of green tea. Polyphenolic compounds are thought to have anti-cancer properties. Camellia sinensis contains a small volume of epigalloctocatine gallate, EGGC, and this a polyphenol. This green tea has been shown to have anti-tumor and anti-mutagenic properties. According to the studies, EGG protects cells from the DNA damage caused by the oxygen reactive species. So green tea polyphenols inhibit cancer cells. Green tea has been found to be effective against colon and stomach cancer. Green tea can help to reduce the harmful effect of radiation. Tea's antioxidant function is responsible for all of the health benefits. Then another plant which is ginseng. I will not go in much detail, but at least you should know the name of the plants and the properties and how it affects. The panax ginseng, it is a long-lived plant that grows mostly in China, Korea, Japan, and Russia. The dried root of the plant of this plant is included. It may be used to treat a variety of ailments, including cancer. Ginseng's active ingredients have been shown to minimize or inhibit the production of tumor necrosis factors in mouse skin, hinder the proliferation and metastasis to cancerous cells. It promotes cell differentiation and increase interferon level. Well, some type of cancerous cells can be hampered by the ingredients in ginseng. In addition, a study conducted in Korea, it concluded that ginseng decreases the risk of cancers in human. And in comparison to the fresh sliced ginseng, juice or tea is the most effective and active for ginseng cancer prevention in its extract and dried powder. Ginseng prevents tumor growth by interfering with DNA synthesis. The active compound of panax ginseng has many beneficial properties, including the reactivation of natural killer cells that have been damaged by chemotherapy and radiotherapy, the induction of the macrophages, and enhancement of antibody reproduction. So after that, we can say that a black cohosh, that is Semifuga racemosa, is a scientific word for black cohosh. It is a shrub that grows in North America in eastern forests. The black cohosh was most widely used for the breast cancer patients during radiotherapy and chemotherapy. It has been used for decades by Native Americans to relieve menopausal symptoms, premenstrual discomfort, and dysmenorrhea. It also causes complications similar to the abortion, Lydia, and was well-known patent drug. This black cohosh, it was also used in pharmacopoeia. From the 19th century, it was being reported. The drug stores, you can find a wide variety of the black cohosh found in your region also. The herbalists have shown that they are healthy and successful treatment option for the menopausal symptoms. It also causes complications similar to abortion. Herbalists have shown that they are a healthy and successful treatment option for the menopausal symptoms. I will not go in much detail. Let us come to the vitamin D. This is, you must be knowing it very well. Exposure to the sun produces vitamin D in the summer. The simple touch with palms, muscles, and face produces a large quantity of vitamin D. You know that people say that please be in the sun. Standing in the sun on the beach before the skin turns pink is equivalent to a 20,000 IU vitamin D oral dosage. To sustain an adequate level of vitamin, our bodies only need 1,000 IU, whereas it provides 20,000 per day. It was a recent research. So in the lack of sunlight, oral vitamin D is the best way to keep the levels up. 4,000 IU can be taken conveniently in one day while still providing other benefits. The kidneys are in charge of keeping the active hormonal forms of vitamin D in the blood. This active form of vitamin D has anti-cancer properties. Vital organs of the body perform their functions by converting the main circulating sources of vitamin D. Many of these organs have a long pathway for converting the circulating forms into hormonal form, which is aided by the exposure of light, sunlight. Well, cytotoxic herbal cure. The selective toxicity of herbal treatment against cancer cells is one of the most intriguing characteristics. A variety of phytocompounds have been shown to have selective toxicity against breast cancer cells. One of them is artemisinin, was isolated in Artemisia annua. And you know this plant that it has been selected for Nobel Prize to a Chinese scientist, Professor Tu Yu in 2016 probably. I know her very well from China, and also she visited UAE because she received the Sheikh Zayed International Award for Chinese medicine. So artemisinin is one of the, when a sufficient amount of iron, ferrous iron was present in the cells. So it is very important to know about it. Artemisinin and its analogues was selectively kill cancer cells under high iron concentration when cancer cells have a higher iron influx. Aside from that, polyphenol-rich extract of Hibiscus sabdarifa. Here we take tea of that. An aqueous extract of Brucia javanica have been shown to have selective cytotoxicity. However, further research is needed to isolate the specific cytotoxic component of these plants. Please tell me how much time I have. According to that, I should cut it short. Madam Elena?
Yeah, you can finish within 10 minutes.
How much time I have?
Yeah, 10 minutes, doc.
Okay. The combination therapy. The combination therapy by herbal remedies and synthetic drugs. This combination therapy treatment, which combines natural therapy with synthetic medications, could be the only option for women with advanced breast cancer who are unable to undergo surgery. A herbal drugs combination effect with conventional cancer drugs can increase one of the drugs' bioavailability, making the treatment more successful, you can say. So basically, several scholars have proposed that medicinal compounds be used as a treatment modality because they improve the anti-cancer efficacy of currently available medications. Cancer has been found to be a condition that can be avoided by changing I think I have to tell about it. Changing one's diet and nutrition. According to a recent study, diet is linked to about 35% of cancer cases, is linked with the. Several epidemiological and experimental trials have been shown that a healthy consumption of fruits, vegetable, and herbal products is inversely related to the prevalence of breast cancer. A diet high in phytoestrogen, polyphenols, and chemoprotective agents lower the risk of breast cancer. Herbal dietary supplements are less poisonous and more readily metabolized. Furthermore, in post-chemotherapy patients, nutritional intake of these herbal therapies aid in the reduction of side effects. Hot flashes are one of the most common signs of the adjuvant chemotherapeutic injury in post-treatment breast cancer patients. I will not go about details of the mechanism. Basically, you know that the anti-cancer properties of herbal compounds include antioxidant, cytotoxic, anti-proliferation, and apoptotic functions, among the others. Methyl transferase inhibitors, DNA shielding agents, antioxidants, histone deacetylases inhibitors, and mitosis disrupt, and among the 5 types of plant-based cancer agents. Plant-derived compounds, as you know, have antioxidants, cytotoxics, antibiotic, and apoptotic activity, which both contribute to the anti-carcinogenesis process. Other aids in chemoprevention by preventing DNA damage. modulating cancerogenesis in signaling and inducing cell death by apoptosis. In vitro and in vivo studies back up the anti-cancer properties of herbal compounds. There was a research on that. So the herbal compounds antioxidant activity as the equilibrium between the development of reactive oxygen species and the antioxidant protection is disturbed. Herbal compounds of oxidative stress develop antioxidant function. The formation of oxidative stress and subsequent production of reactive oxygen species have been related to the pathogenesis of many diseases, including cancer. The body's antioxidant system deals with the oxidative stress and some herbal compounds which may improve this machinery. Curcumin, I have explained all details about curcumin. For example, boost the activity of antioxidant enzymes, making cell more resistant to oxidative harm. It was reported by many people. Well, this curcumin was also shown to increase the behaviors of GSS, SOD, GPX, GR, GST, and CAT in paracetamol-treated rats. Other plant-based compounds such as epigallocatechin, which is found in tea also, I have described about green tea. Gallate, a component of green tea, were found to reduce lipid peroxidation and protein carbonyl content in the rats when given orally, likely through improving GSH redox status. So basically, some herbal compounds tend to mitigate oxidative stress and hence play a part in cancer prevention. Herbal medicine for prevention and therapy in breast cancer. To provide scientific justification for the use of herbal medicine, it is necessary to record and publish preclinical and clinical evidence-based. The concerns with the herbal medicine, including the consistency and the standardization of the herbal product, particularly the presence of bioactive compounds, they are responsible for the effectiveness, mode of action, safety, and herb-drug interaction. Is if used as complementary and alternative medicines need to be further exposed. L.B. Moses et al. Investigated the anti-cancer activity capacity of Euricoma longifolia. This plant, locally known as tongatali, and I also worked on this plant when it came to us for the standardization purpose and to see that whether it can be registered as a medicine in United Arab Emirates or not. The leaf extracts and their probable anti-cancer mode of action in vitro against non-hormone dependent and hormone dependent breast cancer cell. Well, the leaves of longifolia were converted into both unfermented and fermented products, which were then screened and their action against both cancer cells. This extract has the highest level of phenolics such as gallic acid, chlorogenic acid, ECG, and EGCC, gallocatechin, as I reported in the green tea, which can contribute to its potent anti-cancer action. Since it's quite a wide study have been done on this plant, hence I will not go in much details and I will show only a few more. A range of herbal compounds can aid in the prevention of angiogenesis in breast cancer. The most active angiogenesis inhibitor is genistein. It is an isoflavone which is found in many plants. A flavonoid phytoestrogen related to decreased expression of WEGF, PDGF, UPA, MM2, and MMP9. Curcumin has also been discovered to an important regulator of angiogenesis. Reversitol and quercetin, these are all plant compounds, block the migration and tube development of bovine aorta endothelial cells, which inhibit angiogenesis. So with this, I will go I will try to conclude the things, because a lot of research have been carried out with us. There are a number of the other scientists who are working on that. there is one sinobufacin, is a potent protected traditional Chinese medicine that has been widely used for the treatment and prevention of breast cancer in China. The medicine, as I told you just now, that Professor Yu she did for the malaria parasite, for malarial drug artemisinin. Similarly, this is also one of the drugs, sinobufacin, is for cancer. The medicine is obtained from the skin of toad, bufo, gorgonizins, and contain diverse compounds as todoxin, dihydroxy, tolutoxin, serotonin, and arginine complex. So this is an important thing. And injection has also been as a mixture of selected traditional Chinese herb injection composed of extracts of Panax ginseng. This plant also I briefed before. Acanthopanax and some other harms, and Platypellas has been used widely to treat the breast cancer in China. One scientist has conducted a systematic study on this, and she is also very much she worked more random control experiments with greater sample size and should be carried out, as should elucidation of the detailed mechanism, that is the biochemical and molecular level. So after that, let us see that one more plant I would like to tell you. Before concluding the talk, let me tell you one more thing. A wide range of contributors from a diverse research stage, diverse research scope. They have investigated two plants, Lonicera japonica, Artemisia capillaris, and Cordyceps militaris. These compounds are also very important in the sense that it's a good cure for the cancer. Now, let me conclude that breast cancer is caused by a complex set of factors. Many of them function alone or in combination, particularly in high-risk individuals. Early screening of high-risk patients as well as proper monitoring in treated causes has been advocated in order to detect recurrence at an early stage. Advances in healthcare science, on the other hand, have resulted in the discovery and classification of the majority of breast cancer varieties as well as their substance cure. However, due to the variety of risk factors, the occurrence and prevalence of breast cancer at an alarming place in both developed and emerging countries. This, I would like to conclude my talk. I am thankful to the organizer for giving me a chance, although really a very busy schedule for me. Yesterday I was in China, today I am here, and tomorrow I am visiting India for a conference. But I am really thankful to the organizers. I am also thankful to our chairperson and the founder Lotus Holistic Institute for encouraging me to present these findings. With this, I am thankful to all the audience for their true concentration.